What we try to do is bring together all stakeholders in quality, and that includes medical device manufacturers, pharmaceutical companies, payer representatives, for example, government representatives, and really try to put some order around what is a very, very complex organism, and that's measuring physician and provider quality. Healthcare reform, delivery reform is moving along, and it really doesn't matter who's in Congress. It doesn't matter if portions of the Affordable Care Act are repealed or replaced. The fact is that healthcare delivery in the United States is changing. And some of the things that are changing is that we as providers are being held accountable, not only for costs, and we've been accountable for that in the past, but also health outcomes that are of high value to patients, and also outcomes of populations. We're seeing tremendous consolidation in healthcare systems, in payers, and all of that. And the amount of data now available through a number of different databases and also transparent to the public is much greater. So unless physicians understand that, and unless we learn to adapt and actually lead the effort, we're just going to get steamrolled, and that's going to be too bad. So the days of the doctor going out and hanging a shingle up are diminishing. Most of the fellows that are coming out in gastroenterology and most areas of medicine are going into some sort of healthcare system. They're not going to go back to not using an electronic medical record when they've been trained in a place that uses an EMR, for example. The amount of regulation, the amount of difficulty, the amount of finance involved in trying to support a practice is just tremendously difficult. And we're just not seeing that trend in healthcare anymore. So we have to adapt to that. When I came out of medical school, I had $5,000 in debt, which is just pitiful. Now the average debt is over $200,000, and many physicians come out with debts of $250,000, $300,000. And then if two physicians get married, it basically doubles. So that is driving choices in terms of jobs. It drives choices in terms of where people live. It makes it very, very challenging to recruit people for academic positions, for example, like at Yale. Very, very difficult to pay salaries that are even close to being competitive. So it's a challenging problem, and it needs a solution. It needs a solution by all the stakeholders coming together.